autoimmune diseases, types, symptoms, causes, and more. What is an autoimmune disease? An autoimmune disease is a condition in which your immune system mistakenly attacks your body. The immune system normally guards against germs like bacteria and viruses. When it senses these foreign invaders, it sends out an army of fighter cells to attack them. Normally, the immune system can tell the difference between foreign cells and your own cells. In an autoimmune disease, the immune system mistakes part of your body, like your joints or skin, as foreign. It releases proteins called autoantibodies that attack healthy cells. Some autoimmune diseases target only one organ. Type 1 diabetes damages the pancreas. Other diseases, like systemic lupus erythematosus, SLE, affect the whole body. Why does the immune system attack the body? Doctors don't know exactly what causes the immune system misfire. Yet some people are more likely to get an autoimmune disease than others. According to a 2014 study, women get autoimmune diseases at a rate of about 2 to 1 compared to men, 6.4% of women versus 2.7% of men. Often the disease starts during a woman's childbearing years, ages 15 to 44. Some autoimmune diseases are more common in certain ethnic groups. For example, lupus affects more African American and Hispanic people than Caucasians. Certain autoimmune diseases, like multiple sclerosis and lupus, run in families. Not every family member will necessarily have the same disease, but they inherit a susceptibility to an autoimmune condition. Because the incidence of autoimmune diseases is rising, researchers suspect environmental factors like infections and exposure to chemicals or solvents might also be involved. A Western diet is another suspected risk factor for developing an autoimmune disease. Eating high fat, high sugar, and highly processed foods is thought to be linked to inflammation, which might set off an immune response. However, this hasn't been proven. A 2015 study focused on another theory called the hygiene hypothesis. Because of vaccines and antiseptics, children today aren't exposed to as many germs as they were in the past. The lack of exposure could make their immune system prone to overreact to harmless substances. Autoimmune disease symptoms. The early symptoms of many autoimmune diseases are very similar, such as fatigue, achy muscles, swelling and redness, low-grade fever, trouble concentrating, numbness and tingling in the hands and feet, hair loss, skin rashes. Individual diseases can also have their own unique symptoms. For example, type 1 diabetes causes extreme thirst, weight loss, and fatigue. IBD causes belly pain, bloating, and diarrhea. With autoimmune diseases like psoriasis or RA, symptoms may come and go. A period of symptoms is called a flare-up. A period when the symptoms go away is called remission. Symptoms like fatigue, muscle aches, swelling, and redness could be signs of an autoimmune disease. Symptoms might come and go over time. When to see a doctor. See a doctor if you have symptoms of an autoimmune disease. You might need to visit a specialist, depending on the type of disease you have. Rheumatologists treat joint diseases, like rheumatoid arthritis, as well as other autoimmune diseases like Sjögren's syndrome and SLE. Gastroenterologists treat diseases of the GI tract, such as celiac and Crohn's disease. Endocrinologists treat conditions of the glands, including Graves' disease, Hashimoto's thyroiditis, and Addison's disease. Dermatologists treat skin conditions, such as psoriasis. Tests that diagnose autoimmune diseases. No single test can diagnose most autoimmune diseases. Your doctor will use a combination of tests and a review of your symptoms and physical examination to diagnose you. The anti-nuclear antibody test, ANA, is often one of the first tests that doctors use when symptoms suggest an autoimmune disease. A positive test means you may have one of these diseases, but it won't confirm exactly which one you have or if you have one for sure. Other tests look for specific autoantibodies produced in certain autoimmune diseases. Your doctor might also do non-specific tests to check for the inflammation these diseases produce in the body. How are autoimmune diseases treated? Treatments can't cure autoimmune diseases, but they can control the overactive immune response and bring down inflammation or at least reduce pain and inflammation. Drugs used to treat these conditions include nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, Motrin, Advil, and naproxen. Immune-suppressing drugs. Treatments are also available to relieve symptoms like pain, swelling, fatigue, and skin rashes. Eating a well-balanced diet and getting regular exercise may also help you feel better. 4 common autoimmune diseases. 1. Type 1 diabetes. The pancreas produces the hormone insulin, which helps regulate blood sugar levels. In type 1 diabetes mellitus, the immune system attacks and destroys insulin-producing cells in the pancreas. High blood sugar results can lead to damage in the blood vessels, as well as organs like the heart, kidneys, eyes, and nerves. Symptoms. Type 1 diabetes signs and symptoms can appear relatively suddenly and may include increased thirst, frequent urination, extreme hunger, fatigue and weakness, blurred vision. The exact cause of type 1 diabetes is unknown. Usually, the body's own immune system, which normally fights harmful bacteria and viruses, mistakenly destroys the insulin-producing islet, or islets of Langerhans, cells in the pancreas. Risk factors. Some known risk factors for type 1 diabetes include family history. Anyone with a parent or sibling with type 1 diabetes has a slightly increased risk of developing the condition. Genetics. The presence of certain genes indicates an increased risk of developing type 1 diabetes. Age. Although type 1 diabetes can appear at any age, it appears at 2 noticeable peaks. The first peak occurs in children between 4 and 7 years old, and the second is in children between 10 and 14 years old. 2. Graves' disease. Graves' disease attacks the thyroid gland in the neck, causing it to produce too much of its hormones. Thyroid hormones control the body's energy usage, known as metabolism. Having too much of these hormones revs up your body's activities, causing symptoms like nervousness, a fast heartbeat, heat intolerance, and weight loss. One potential symptom of this disease is bulging eyes, called exophthalmos. It can occur as a part of what is called Graves' ophthalmopathy, which occurs in around 30% of those who have Graves' disease, according to a 1993 study trusted source. Common signs and symptoms of Graves' disease include anxiety and irritability, weight loss, despite normal eating habits, enlargement of the thyroid gland, fatigue, rapid or irregular heartbeat, palpitations. Graves' disease is caused by a malfunction in the body's disease-fighting immune system. It's unknown why this happens. 3. Autoimmune hepatitis. Autoimmune hepatitis is liver inflammation that occurs when your body's immune system turns against liver cells. The exact cause of autoimmune hepatitis is unclear, but genetic and environmental factors appear to interact over time in triggering the disease. Untreated autoimmune hepatitis can lead to scarring of the liver, cirrhosis, and eventually to liver failure. When diagnosed and treated early, however, autoimmune hepatitis often can be controlled with drugs that suppress the immune system. A liver transplant may be an option when autoimmune hepatitis doesn't respond to drug treatments or in cases of advanced liver disease. Types of autoimmune hepatitis. Doctors have identified 2 main forms of autoimmune hepatitis. Type 1 autoimmune hepatitis. This is the most common type of the disease. It can occur at any age. About half the people with type 1 autoimmune hepatitis have other autoimmune disorders, such as celiac disease, rheumatoid arthritis or ulcerative colitis. Type 2 autoimmune hepatitis. Although adults can develop type 2 autoimmune hepatitis, it's most common in children and young people. Other autoimmune diseases may accompany this type of autoimmune hepatitis. 4. Hashimoto's disease. Hashimoto's disease is a condition in which your immune system attacks your thyroid, a small gland at the base of your neck below your Adam's apple. The thyroid gland is part of your endocrine system, which produces hormones that coordinate many of your body's functions. Inflammation from Hashimoto's disease, also known as chronic lymphocytic thyroiditis, often leads to an underactive thyroid gland, hypothyroidism. Hashimoto's disease is the most common cause of hypothyroidism. It primarily affects middle-aged women but can also occur in men and women of any age and in children. Doctors test your thyroid function to help detect Hashimoto's disease. Treatment of Hashimoto's disease with thyroid hormone replacement usually is simple and effective. Complications: left untreated, an underactive thyroid gland, hypothyroidism, caused by Hashimoto's disease can lead to a number of health problems. Goiter. Constant stimulation of your thyroid to release more hormones may cause the gland to become enlarged, a condition known as a goiter. Hypothyroidism is one of the most common causes of goiters. It's generally not uncomfortable, but a large goiter can affect your appearance and may interfere with swallowing or breathing. Heart problems. Hashimoto's disease may also be associated with an increased risk of heart disease, primarily because high levels of low-density lipoprotein, LDL, cholesterol, the bad cholesterol, can occur in people with an underactive thyroid gland, hypothyroidism. If left untreated, hypothyroidism can lead to an enlarged heart and, possibly, heart failure. Mental health issues. Depression may occur early in Hashimoto's disease and may become more severe over time. Hashimoto's disease can also cause sexual desire, libido, to decrease in both men and women and can lead to slowed mental functioning.